Good morning, Anne. It's really lovely to have this conversation with you today. I'm sure many of our listeners or those watching on YouTube will know who you are, but I'm just going to introduce you briefly. So, you are one of our deputy directors of community education for primary care. You're a lecturer in medical education. You've got many areas of special interest, which include health promotion, public health, global health, primary care, and research. You work on a master's program as well, and I think you are kind of one of the main drivers for keeping us as a team kind of research focused. And so, yes, welcome to the podcast. And I just also wanted to say, after many years of experience and many awards, you've recently also had a GKT sort of Lifetime Achievement Award and a RCGP honorary fellowship, which for a doctor who is a non-GP, that's quite amazing. So I wanted to say welcome, and just so that those who haven't met you get to know a little bit about your background. The reason we're talking today, Anne, is because you've recently had a patient experience and I know you, and when we used to sit in an office together, you'd be at your standing desk, you run, you cycle, you're incredibly fit and healthy. And so I imagine it must have been a bit of a shock suddenly going onto the other side and being a patient. I mean, I know you a mother and a grandmother, but this was quite different, especially during the pandemic. And I wondered if you could tell us a bit about it.
Well, good morning, really, and thank you very much, and thank you very much for that lovely introduction. Yes, it was all a bit of a shock, and I'm going to give you a very short narrative, and then kind of highlight some of the points I take away from this, just so people get a flavour of the situation. So, a very acute onset of bizarre and unfamiliar symptoms just towards the end of December last year when we were in lockdown. And I was at quite a loss to even explain what was going on. I felt very bewildered and confused. Another rather strange thing was I didn't even know who my GP was. I have not really been a patient. And although I'm registered with a local practice, it's quite a big practice, I had no idea who my GP was, and I had never navigated the e-consult system. So suddenly I was faced with that, and should I or shouldn't I bother my GP? Should I just wait a few days more after the holidays? But sooner or later, my husband got really worried, and he spoke to my daughter, who's a GP. Now, I didn't want him to do this because she's a busy mum with 3 under 5s and lives 50 miles away. We're not allowed to see each other. It's locked down. You'll only worry her. But anyway, he went ahead. She really got concerned as he tried to describe the symptoms. And she said, you must contact the GP, which I did. I found a way around it. And I got rather bland reception initially. And she then spoke to her husband, who's also a GP, and he created a text to go into the e-consult for me to use to clarify, really, this is a strange situation and it should be treated urgently. Well, very quickly, I got both a telephone call from a different GP. He was one of the senior GPs, partners of the practice, and he explained that I needed to get down to the local A&E and very quickly, because the MRI services would be closing for the New Year's holiday. So could I get there? And I said, oh, yes, my husband can get there. And off we went, very bewildered, very confused, very vulnerable, a situation which doesn't often come to me, and very helpless. So after 3.5 hours in this strange A&E department with all the COVID restrictions, and it was very cold, of course, with no heating, doors were open, etc. My mobile phone wouldn't work, there was no signals, but all these various experiences, after 3.5 hours, the duty doctor in A&E gave me my provisional diagnosis, sent me home. I had to call my husband and wait for him, and that was a bit awkward too. But we were hungry, it was late, and I gave this provisional diagnosis to my husband and my daughter, and they said, that's exactly what we thought, Mum, as soon as you started saying things, and this is really serious. So it was spinal stenosis, very acute onset, but the team at A&E weren't qualified to do too much. They just said, we'll have to wait till after the holidays. One of the orthopedic surgeons, the consultants, will be in touch with you and you'll get a very urgent appointment. This was all happening. It was the Christmas, New Year holidays, so I thought I won't need to tell anybody. I'll just keep it quiet. It'll all go away. And then I realised that actually I hadn't told my narrative properly in the first place. And probably the poor GP who was on duty, the duty GP at the first contact, had no idea that I was a 72-year-old, very active, very healthy woman. All he could see was there was nothing on my notes. My notes were just there. And how was he to know anything about me? He couldn't physically see me or examine me. However, we eventually had a face-to-face meeting then with my consultant surgeon. He'd already spoken to me on the telephone and told me it was quite serious. I had a letter, an e-letter with all the seriousness of all this, and I still was in shock, disbelief, etc. And he explained what the surgery would be like. He showed me the MRI. It was quite, and that the operation would be about an hour or so long, so it's quite a serious operation. But on the other hand, I'd be discharged within a couple of days. I could do light duties after about 2 weeks, and I'd probably need to have 4 weeks off work. Wow, me, never had sick leave. So it was quite a strange experience, and I was still in a state of shock. But by now, the consultant and my daughter and I had a very adult, professional conversation. He pitched it well. He also knew how to explain the risks without frightening me. But, you know, the reality of this, it's a spinal surgery. It may not even work, and I had to take that on board. However, focus now on getting this off, getting a date, getting it done as soon as possible. I still didn't tell anybody at work because the lockdown had the advantage of enabling me to carry on work and no one needed to know. I was on no medication or anything like that. But then at home, on my own, just after all my pre-op tests had been done, the phone goes, and it's the anaesthetist to give me another bit of bad news or surprise news, which really shook me. And it was that they discovered I had HOCM. At first, I couldn't believe it. And then I thought, I'll look into this. This can't be right. But I was really distressed at this point. And then I thought, who do I tell? Who do I mention this to? My operation was cancelled. And I had to wait until I could see a cardiologist to discuss the results before the operation would go ahead. All I wanted was to get better, get over this. And now I'm in this awful situation. I have to tell my siblings, I have to tell my children, everyone has to be tested. And they're all getting worried now about HOCM and whether we've all got it in the family. However, everybody was fine. So that was okay. I've got it, as it happens, actually, I'm going for the next bit of my stress test tomorrow and the treadmill tests at the cardiology department tomorrow. However, the consultant then said, it's quite serious at the moment. We can't tell all the details, but we can authorise the anaesthetist that they can go ahead with the surgery. So I duly went ahead with the surgery, gave the date to my colleagues, worked around that and felt okay. So I do want to just say that I was a very fortunate person. First of all, I'm in a professional team. I've got a daughter who's a GP, so as a husband, I've got a supportive husband myself. I've got a nice place to work, and I was able to keep a lot of things quiet because of COVID and the lockdown, and I could carry on with my work. And I was really concerned about how I would manage everything to do with work while I was having this sick leave, and would I actually be okay post-op? It wasn't a pleasant experience in hospital, far from it, as you'd expect, but it was a 3-day hospital stay. A few things went wrong, but very quickly I was able to get walking, get home, get on with life, and start to open up a little bit more and return to some sort of normality. Another 6 weeks and I should be able to gently start running and jogging, which will be great, but I've also got to do that in aligning that with the cardiology findings, which I hope will be soon. So the points I would like to make from a medical educational point of view, we talk about communication, getting the patient's story, learning about the patient's journey. But the key things I would say is that the patient's journey is unique, no matter what the condition is, how complex or how simple. It's a unique journey that the patient probably never expected. I certainly didn't expect, and I wouldn't assume to understand the situation in anybody else who's had acute onset symptoms that are related to spinal stenosis. I also, the shock of being told about the HOCM really took me by surprise, and how I felt about it took me by surprise. So there's a lot packaged in there that we must make sure our students and the GPs who teach them can all pull this together. And I think on the whole we do, but it was a real eye-opener to me just how important this was. And I do think that in the end, with the help of my daughter particularly, and coming to various appointments with me, I felt they avoided treating me in the end as an elderly patient, but an active, well-educated professional woman, and working around how I could resume to a fulfilling life as quickly and as safely as possible. So I think those are my key things on the patient experience. It'll live with me a long time, this.
Thank you so much, Anne, for sharing your experience, because I think you're absolutely right. It's such a personal experience and it's so different for everybody. But I'm also struck by a few things I wanted to sort of pick up with you. One was just, like you say, assumptions that might be made because of your age, and not really looking at who you are as a person, and the fact that your medical records are empty. You didn't know who your GP was because you were so fit and healthy. Um, and but also, given the fact that you've worked in medical education for years, you have doctors in the family. I know your father was a doctor as well. Actually, you really struggled with navigating the system and making your voice and your narrative kind of coherent. And someone else, a GP in your family, had to do that for you. I'm really struck by how sort of the system doesn't enable us. First of all, you're in COVID and having to do e-consults and not being seen in the normal way. And then you, who usually does, like you say, doesn't struggle to find your words or your voice, you're suddenly in a really, difficult position. And I just wondered how that must have felt for you.
Oh, I think it felt really disconcerting. I was really confused. In a way, I was so glad it was COVID and we were locked down, because I didn't have to go anywhere or explain anything. I just had to kind of process this somehow.
Yeah.
Um, it was a real, it was really difficult before the diagnosis, I must admit, because that was the strangest thing, trying to kind of explain my symptoms. And I do know now from the consultant surgeon that altered sensations are quite common, but they can be very differently experienced by different people. So I had no pain and lots of other things, but it was really through me completely. And as I say, I couldn't have managed if we weren't in lockdown. I don't know how I would have coped with wanting to do the normal things that we do, especially at Christmas and New Year.
Yeah.
And there's a trio of birthdays in our family around that time, which we'd already had to say, well, we won't be able to see each other, it won't be happening. So it really felt as if I had suddenly lost control of everything. I was so vulnerable, and I couldn't even explain my symptoms properly. They felt so bizarre. And I would say that that need to ask my son-in-law, I think that I was fortunate that they quickly picked up on what it could be. So they had a provisional diagnosis in their mind, um, and then started adding little bits to make sure that they were on the right track as they navigated with me. And I don't think a duty doctor on call at a GP practice who doesn't know a patient, I don't think he had a chance of working out what was going on, to be honest. So I did feel reassured that I had them, but at the same time, it was pretty disconcerting. And even then, once I got the provisional diagnosis after the A&E appointment and the MRI, I thought, good grief, how am I going to live with this? How do I do, where am I? So it really threw me. And yeah, I didn't feel, I wouldn't say I went into any kind of clinical depression, but it was certainly through me, and my normal behavior, my normal character and personality was all completely altered.
And yeah, I can completely hear that. It really knocked you, I think. And then getting the cardiomyopathy diagnosis when, actually being fit and healthy, being active as a kind of person, as a kind of, as a grandmother, all those things really have are hugely important to you. And I can see how all of that knocked you. And I was hearing what you said about kind of the worry about, you know, everyone else needing to be screened and getting back to your normal life. So it's interesting that the pandemic actually, because we were sort of locked down, actually sort of there was some benefit personally for you because you weren't missing out on those things you normally would. Um, but I'm also really aware that, you were in A&E during a pandemic on your own for, hours before anyone saw you in with, it must have just been so strange and so isolating being on your own. And I wondered whether sort of, I know you said post-operatively, it wasn't great either. And I wondered whether you were on your own post-operatively as well.
Yeah, that was very, very distressing. My husband dropped me off at 6:30 in the morning on the day of the op at the outside part of the unit, and he wasn't allowed in at all. And he was there 3.5 days later to take me home. So there was no physical contact with anyone other than the staff, and it was a small unit for female patients, so that was okay. The telephone worked intermittently, but I did have daily conversations with everybody. But that was really, really an awful experience being alone like that. One doctor, young doctor, was one of our graduates from 2017. So that was very nice. He couldn't believe he was seeing me in this state. But he cheered me up a lot, and I was glad about his success and his movement on. But the lying in bed, so when things went wrong, I had a drip on one side and a catheter on the other. So I was lying flat on my back with this awful wound. All my body is on this wound for 48 hours. And just getting to the phone and trying to communicate and chat with everybody. And then I ran out of reading material because I didn't think I'd be in that long. I couldn't work out how to download anything because my phone wouldn't work properly. So it felt very isolating, uncomfortable. Whilst I would say everyone was very nice, and I can't fault the care. It was just an awful experience that I hadn't anticipated, that the post-op would go so wrong so quickly. But
I know, I have to say, and because I know you had normal deliveries with your children, but I can sort of relate to that awful sense of like powerlessness after surgery, having had two C-sections, and just, it's horrible being hooked up to a drip, having a catheter in. I just kept going, how soon before I can get this out? I just need to look after my children. And, especially when I had the twins, I was really like, I just need to get up and out. And you just need to get these things out of me and I need to get home. So I could, I know it's not the same at all, but there's that bit of it I can really relate to. But I still had visitors coming in and my husband was there visiting and so yeah, I just can't imagine how horrible that must have been. Thank goodness for that, our previous medical student who was a junior doctor there, and just someone to kind of chat to and who and just to be back to your normal self. And the other thought I had about the things that kind of helped that really jumped out at me was the consultant, that having that really nuanced discussion about the reality without scaring you and the risks. And I think that can be, a really tricky conversation because I think sometimes people can just list all the risks and absolutely terrify you. But also just how frightening it was being shown the MRI scan. And I just wondered, do you think they showed you that scan because they knew who you were and they, knew you were in education and had doctors in the family? Or do you think they showed everyone that, their scans?
Well, I think it was partly because my daughter was with me and we were in that professional situation. It was COVID, so there were lots of restrictions. So the fact that I was allowed to go into a consultation room where it was on the screen with the consultant and with my daughter, I don't think that would have happened to everybody. And he was explaining L4 and L5 and everything and why it was so serious. So I think that was probably something I've benefited from because of our situation. I don't know how well they would do that with all the patients. I mean, it may be, but I would imagine that we got a little bit more privileged information and
Yeah,
access to the results to explain. And I think it was also about explaining to me the potential risks of the operation, really, but in a sensible way, because the two alternatives were an injection every 6 weeks or a walking frame. It was a no-go area.
no, that's not an they're not options for you, are they, Anne?
Yeah.
So I'm really pleased that you are getting back to kind of or have almost there, aren't you? Really,
Yes.
but it's
Well,
been
but the altered sensations were immediately relieved.
yeah,
So it was still more about the spinal surgery taking its time to recover. And it has been every stage, every milestone that I was given was likely to happen, has happened. So driving, swimming, cycling, um, walking independently, that's all happened. So, and I've even played tennis once or twice, nothing high caliber, but just ordinary tennis level. Yes, so all that has and I'm confident to walk and drive and everything. Yeah,
brilliant. But yeah, and I'm just sort of left thinking about, I've as well often been shown scans or had results discussed with me on behalf of kind of my own mother. And sometimes that's been, it's sometimes really helpful because I'm quite visual, so it's quite nice to see it. But yeah, it's balance when you've got a doctor as a patient or a relative. And I think working with, what what you guys wanted, but also just I think it's helpful for clinicians to remember how frightening it can be sometimes to see these images.
yeah, yeah,
Um, and Anne, I hope it's okay to share with everybody who's watching and listening that you are going to be retiring at some point next year or fairly soon. And I mean, I can't really think of QMEC without you, so I'm not going to spend too much time on that. But you have been in education. I can't think of the countless number of students and teachers and educators you've kind of worked with and supported. And I just wonder, I know it's really impossible to kind of summarize all of that and to kind of come up with your top tips, but I just wonder whether you had an opportunity to kind of reflect on your career and what your kind of tips would be for the all those people that you've worked with and that we will continue to work with.
Yeah, thanks, Rini. And I think, I've benefited from my own background and family. Um, Social determinants of health and clinical care. My father came over to the UK at the start of the NHS, and very soon in Liverpool, he was in a very poor area of Liverpool where he worked. He would be prescribing things like Librium to patients, and he said, I don't need to do this. I need to prescribe a washing machine and a non-violent partner. And so it struck us really quite early, it struck me early on really, that these other things are the main factors in our health and well-being. And then skip a couple of decades, and my own work had been as a microbiologist, and I would see particularly women with UTIs, the same name again, and you thought, well, doesn't anyone want to help them find a way of being healthy and not getting these infections? We could also see things like smoking becoming a real linked issue to health and well-being. And I left my role as a microbiologist when my children were born, and I became involved in local health promotion activities. It was the beginning of this field of health promotion. And in 1986, the Ottawa Charter was published for the first time, and the international WHO journal called Health Promotion International, which is still, of course, the key journal today. And this was really an exciting time for me to see that I could link the scientific knowledge I had and the public health knowledge I had. So it wasn't just the cause of disease, but what we could do to prevent disease in a more proactive way. And I was fortunate to get involved in health promotion in the public health department here in Berkshire, where I live. Did my master's, and which I really, really enjoyed. And just as about 2 years after I'd finished my master's, the first Tomorrow's Doctors in 1993 was published, and there was health promotion, big and loud in this document. So I duly managed to get a post at King's and look at how we could put this into the curriculum, because there I'd seen my father and other people who knew were clinicians not knowing how to broach these things, making it up as they go along with really good intention. But how do you say to a patient, you need to stop smoking or lose weight? And then if there's no infrastructure for them to do anything about it, it's not going to work. So I did my doctorate, fortunately, at King's, which was a fantastic time. And I was working alongside Professor Ann Stevenson at the time, as we were developing the new curriculum at King's. In fact, every medical school in the UK was developing their new curriculum, but in many ways we were slightly ahead of the game in terms of health promotion, because I was in this post and was doing my PhD in this area. So I was very quickly able to look at publications. In 1997, Harden in Medical Education produced a document, a paper about health promotion and the spiral curriculum. So it was all coming together. And the things that are important for me is that I see it now as a part of normal medical education. We use different words, social determinants of health, inequalities, but these kind of areas are now mainstreamed. And that is a great achievement. And even in the electives in global health, we're looking at these bigger issues about the causes of health rather than the causes of public health. I always think looks at the causes of disease. In health promotion, we look at the causes of health and well-being. And I've traveled the world, and I've been lecturing in Japan and various other places about how this can be in mainstream medical undergraduate curricula. And I think it's a fantastic opportunity for us to really improve health if we can take these things on board. So my top tips are really know your work. If you're going to try and change something, be academically sound, be aware of how your discipline and the discipline of medical education, how they work together. You're going to gain respect and get listened to if you produce something good and sound and academically with rigor. So when you feel passionate about something, or you're at the wanting to change something in curricula and curricular development, this is, I think, that the important thing is to really know your work. If you can, get the ear of key players, the top players, if you can. And that really happened quite quickly for me because I was doing lots and lots of what we called SSCs at the time, student selected components, and students were from this getting publications, they were getting their voice heard, they were wanting to engage, and so student involvement in curriculum became very, very dominant, particularly in our school, but I think now it's generally. And we were able, through the influence of our students who'd experienced some of the teaching I'd given them, and enabled them to have, where we were able to then bring things into more mainstream. And of course, if we just look at our tiny part of the curriculum now, well, it's not that tiny, but I think we're about 13 or 14% in primary care, and we look at every element of it, health promotion is just integrated into it. It's an incredible part of everybody's working arrangements in providing the teaching and facilitating for our students. So I think knowing your stuff, being active in the field, being well read, being able to influence others in a way that is progressive and well argued, good rationale, etc., and working across with different organisations, different medical schools, different fields, broadening your links, but also keeping focused. And I think disseminating your work as best you can. It's very difficult, we know, to get publications, but the conferences, if you can and you can find the funding and everything else, having your name at conferences, presenting abstracts, doing reviews, chairing sessions, that helps you gain credibility. And it isn't about promoting self, but the credibility of what you're wanting to see in medical education. I think that's where, and I don't think it's going away anytime soon. Health promotion, social determinants of health, the different ways we have to do our assessment modalities, the paradigm shifts in research, these are all have changed over the last 3 decades that I've been involved. Yes, I've been here 26 years at King's, but obviously I had also my public health before that, and I will be retiring at the end of March. But I think there's lots going on in this field, and yes, I presume I do confidently feel I have made a difference, but at the same time, it's so well embedded now, it's all going to continue. And particularly, I like the idea that the Masters in Public Health, of which I'm very involved in, has a module, a core module on health promotion. And I've got various colleagues involved in supporting that so that when I leave, it'll carry on. And I think the other final thing would be that when your external examiners are involved in giving you praise, you need to share that and disseminate that. Not me personally praise, but praise for the programme, and because it's got these strong elements in it of health promotion related type work. So yes, I've been around a long time, and I'm sure I'm going to carry on in some way or other being involved, but I'm going to step down from all the major responsibilities and the conferences, which have been, I must say, it's been terrific to have this global perspective as well, and opportunities.
Thank you, Anne. You're absolutely right. That is, you know, huge credit to you, the sort of legacy of work that you will leave behind, because it's absolutely embedded in everything we do and teach. And especially, you have always championed working with and, co-producing work with students. So, we hope we can, someone will be able to fill your big boots. But thank you again for chatting to me today, and especially starting off with sharing such a personal experience that you've had. I think it's really useful for us all to be reminded of what it's like being a patient. Thank
Thank
you,
you very
Anne.
much, Reen. Thank you. Thank you for the opportunity. Thanks.